Today we're going to be doing an injection on a bunny. We're going to actually be giving a penicillin injection just under the skin or subcutaneously. Now this can be for other medications as well, but this particular video is about giving penicillin injections to rabbits. And so with a rabbit, where you want to give the injection is right in between the shoulder blades, and you can typically feel these shoulder blades right up here. They're two little bones that kind of you can feel right through the skin easily. So it's just right behind the head, right in between here. And what we're going to be doing is we're going to be lifting the skin up and actually making a skin tent to give this injection. So what we'll do, and if you're at home, you are going to probably need some help and someone can hold the bun for you. And when you hold the bunny, I like to put the head of the bunny in my armpit so they feel like they're in a bunny tunnel and they're very safe. And then the other person can safely give them medications. Now, I'm going to be giving this by myself in case you are alone. And what you want to do, if you are alone to do this, is I use a towel and we're just going to cover the bunny's head and keep that little area open so he feels like he's in a bunny tunnel. And then we're going to be lifting this skin. I put my hand right on his head. Be on a very safe surface. If you start on the floor, it might be a good idea so he can't jump off the table. But if you're confident that you can hold your bunny and prevent it from jumping off the table, that's okay. But start on a lower surface, I think that's better. Cover the head here. Then you're going to be lifting this skin up. When you lift the skin up, you can actually feel that there's a little indent there, and that's where you're going to place the needle. So we're going to get our medications ready here. If you have penicillin, you need to shake it really, really well because penicillin needs to go into solution, and the bottle that we give you, you can actually see on the bottom if it has settled out. So you're going to shake it until it's all into solution. Penicillin is a medication that needs to be refrigerated. Make sure your penicillin is refrigerated. The needles and syringes that we gave you are in packages. You're going to open the package, take the syringe out, twist the needle on so it's nice and tight. You are going to take the cap off, insert the syringe into the penicillin, turn the penicillin bottle upside down, and draw up the proper amount of penicillin, whatever we have instructed you to do. Once you have pulled it up, sometimes there can be a little bubble. You can pull up some extra and then push the bubble out back into the penicillin jar, and then make sure there's no bubbles in here and make sure you have the exact amount that you're going to be delivering. You're going to turn it upside right, take it out. You're going to recap this syringe, and I don't want you taking this cap and putting it on because you might stab yourself. So leave it on the counter, and you're going to scoop up that and cover it. Then you're going to twist this off and replace it with a new needle. So here's our new needle. We're going to open it up, remove this needle, and twist on our new one. So why do we put on a new needle? Penicillin has these little tiny particles in it, sometimes can get caught in these needles. Also, we've already poked through this and it can actually make the tip of the needle a little bit dull. So a nice new sharp needle is needed to give the injection. Now this particular bunny does not need a penicillin injection, so I'm going to use just saline, which has already been drawn up, but you would be giving your penicillin that you've just drawn up. So I'm just switching this syringe out for now, and I'm using a saline. So this is the same thing, it just contains saline, which it's not going to hurt the bunny or anything like that. So once you're ready to give this injection, again, you want to have that friend hold or put the little towel over his head, keep it close to your body, make sure you're on a low surface so if he jumps, take the cap off of the needle, and then you're gonna make your skin tent. You're gonna feel that little area of the tent, poke through the skin, and he may jump just a little bit, you can see that he did, and then you pull back on the syringe, and then you're gonna deliver it. Then you pull it out. All done, good job. When you pull back on your syringe, you're looking for blood to make sure that you did not hit a vessel. If you hit a vessel, try it again. It's unlikely you'll hit a vessel, but it does happen. So once you poke it through that skin, pull back on the syringe, no blood, deliver the medications. I do like for you to feel afterwards to make sure it's not wet. If it's wet, you didn't do it right and you injected out of the skin. So make sure you check, and if it's all wet, you need to start over. At the end, you want to recap by laying that down, lifting it up, and putting that cap of the syringe on.